I'm sitting here today with the real deal, two board-certified plastic surgeons, but there are providers out there who are not qualified, who are doing procedures, and it's costing people injuries, also costing people their lives. When you see the headlines, when you hear these stories, what comes to mind?
It's really a tragedy when that happens. Certainly in any medical procedure, bad things can happen. But there's been an uptick because plastic surgery has become very popular and people are trying to cash in on that. So unscrupulous practitioners are basically allowed, because there's no one to stop them, to call themselves plastic surgeons, and maybe they'll take a weekend course to learn a procedure and not having the patient's best interest in mind, but they are calling themselves plastic surgeons or even calling themselves board certified. You know, they may be board certified, but not in plastic surgery.
Patients can also get procedures cheaper. Do you think that's part of the draw to these providers who aren't as qualified?
Well, financial availability is obviously a factor, but I'm often impressed by how patients, intelligent patients, may spend more time checking out the television they're going to buy or the restaurant where they're going to have dinner this weekend than they will checking out the practitioner who's going to be altering their body while they're unconscious. Short of being actually fraudulent, just a good marketing campaign can present a practice or a practitioner as something more than they really are. So I would say to the patients, do your homework.
When do you think there's going to be changes where patients will do their homework? When is that going to begin happening?
We have to continue to educate patients to make sure they're being cared for by people who know what they're doing. You know, I like to tell patients that, I encourage them to seek other consultations. I think a second consultation is better than a second surgery. And the more people they see, the more information they get. They should talk to their friends, they should talk to their doctors, and really find out to make sure that their physicians are qualified and they are who they say they are.
There are practitioners that are presenting themselves as plastic surgeons, and even among plastic surgery, I think that the patient needs to say to the doctor, how many times have you done this operation? Show me pictures, your patients. I want to know how you individually can give me the best possible result.
And to find the best plastic surgeon, we have lots of information at theplasticsurgerychannel.com.